Hey folks, Miss Schossler here from Nursing 300. Happy to have this few minutes to talk to you about how the assignments really flow together in this class. Hopefully this will answer some of your questions and maybe even create more questions in your mind that you can reach out to me with. So, let me just say also that I love to talk to students. So if you're thinking you have some questions or just want to sit down and talk to me about potential topics, I would love to talk to you. Reach out by text message, telephone, email, however you want, so that we can make sure you're on the right track. And if your topic might need to be changed or you just need to talk through it, I would love to do that with you. So these are the 3 assignments in this course. In week 4, you've got the research paper critique. That's on 1 research paper. Week 5, you've got a literature review. This is part 1 of a final paper. So you notice that week 5, you turn in part 1, then I'm going to give you feedback on it, and week 7, you're going to turn in the final with part 1 and part 2. So I'll explain that more as we go. Now I want to show you how they fit together with the discussions and really kind of what your opportunities are to change topics if you so desire. Let's see if I can enlarge this just a little. Oops. The topics that you choose in week 2, in the discussion for week 2, and I know this is early in the game when we get to the week 2 discussion, you're going to choose a topic in this discussion that you could actually use throughout the rest of the course for many of your discussions and all of your assignments if you so choose. However, it doesn't have to be one that you use as you go forward. It can change. You might decide you don't like it. You might decide there's no research out there on it, making it very difficult to write papers, or you might decide something else really spurs your interest or sparks your interest more. So the week 2 discussion, in that discussion you're doing reading that helps you learn about where to find nursing research. And remember, one of the big keys here is nursing research. So you'll do some work in the discussion, the module, the resources that'll help you understand where to find research on nursing. And then you're going to go pick a topic that is interesting to you and applies to your clinical area. So that's a broad set of directions there. That you're going to pick a topic that is a nursing related topic. Remember, it must be nursing related, and it applies to your clinical area. It interests you, and then you've got to go out and find research on it. And that research, the high level evidence and research, you'll be looking for more of it as you go along. But in the week 2 discussion is just where we start to play with that topic. So you're going to choose a topic in this week 2 discussion that you can use as you go forward, and you might even find that it doesn't work out and you have to change topics. Either way, you're going to be just fine. So after the week 2 discussion, and believe me, in week 2 you're going to get some feedback from your instructor. If you don't feel like you got enough feedback from your instructor helping you know if it's a good topic, then please reach out to me. I would love to talk to you. Sometimes we need to see the topic more specific, and you'll usually get that feedback if I feel like you have that problem, that you need to really narrow it down a little bit to help you out in the future weeks. In week 3, the discussion is to identify the topic of your research paper for week 4. So we're going to kind of force you in week 3 to take a stand and say, this is the topic that I choose for my research paper that I am planning to do in week 4. We know you don't have your paper done yet. You're just starting to think of it. So you're planning ahead for the week 4 paper, that first assignment, in week 3. You might even have decided in week 2 that you already know what your topic is because you wrote about it in your discussion area already. So in week 3, the discussion, you identify the topic and you talk about the topic itself, and you talk about why you chose the topic what evidence is worth studying in the topic, and then you apply it to your clinical area. You're going to do all those things in the discussion area for week 3. So again, that gives us another opportunity for me to give you feedback if you're off track or you need to narrow it, or maybe you've chosen a medical topic instead of a nursing topic. Let me give you an example there. The topic of medication orders is a medical topic. The topic of whether to choose which medication is best for hypertension is a medical topic. The topic of what treatment to do for a patient with an MI or a stroke, medical topics. Doctors get to make those decisions. So we want you to stick with nursing topics, and I'll give you some examples of those. Again, in this week 3 discussion, you could use that topic going forward all the way through. Or you might get some feedback that says you really need to change it, or I might let you go forward with it and you decide that there's not enough research out there and you change a little bit later. In week 4, you're going to take your chosen topic and talk about possible research funding sources for it. So it pulls your topic into the discussion, but your discussion isn't solely about that. It's about research funding. And then the week 4 paper is due. That is your first assignment, your research paper critique. You're choosing any nursing research article. It's easiest here to choose a quantitative research article because you're going to need quantitative articles for the week 5 assignment. And if you choose well and keep your topic, you'll have one of your articles already for your literature review in week 5. So in week 4, any nursing research article that is on your topic, and your topic is kind of already approved already from me because you'll have had feedback in the week 2 and the week 3 and the week 4 discussion areas. Remember, easiest to choose quantitative. You want only from peer-reviewed nursing journals. So don't go to the NIH, don't go to the CDC, don't go to those .gov places. You want to stick in the library with nursing journals. Peer-reviewed from within the last 5 years, nursing topic. So you're going to choose one high-level research article, high-level evidence article, and it's going to be on a nursing topic. And then if you so desire, the easiest path here is to take a quantitative research article because you can then use that article in your week 5 paper as well. The week 5 discussion is next, and that pulls your topic in again as you talk about how your clinical knowledge and your experience add to the information you found in the research article. This is really about the 3 legs of evidence-based practice, and hopefully you'll get that as you go through the reading in week 5. And then the week 5 assignment is your literature review part 1, and this is on that same topic that you could have been using ever since week 2, unless you changed your topic or got feedback that it was not a nursing topic, or you didn't find research on it and you wanted to switch your topic. But you could have been using the same topic the whole way along, 2, 3, 4, 5. And here you must choose quantitative research articles, peer-reviewed from the last 5 years. You're going to gather research on your topic, and you're going to show what is known about that topic. Really, it has to be a specific topic, and it's the first half of that final assignment. The great thing about the week 5 assignment is it's a part 1 assignment that you're going to turn in. I will give you feedback on exactly what you need to change to make it better or how to refocus it, and then you'll work on it more in the week 7 assignment. Then in week 6, the discussion might address your topic if you happen to have chosen a nursing research topic that addresses vulnerable populations. The discussion is really all about vulnerable populations, what that means, and if your research that you chose already to look at happened to have been collected on vulnerable populations, or you can talk about it easily as an example, then you'll talk about your topic in this discussion as well. But it might turn out that your discussion for week 6 doesn't even address your topic because it's all about vulnerable populations in week 6. Week 7, the discussion is not on your topic, though you certainly could create examples from your topic. This discussion is all about community-based participation research and patient-centered outcomes. So it doesn't really have to talk about your research topic at all, though you could. And in week 7, you've got your final paper, part 1 and 2 together, and you're going to complete the literature review in it and do a summary and application of the nursing application to both nursing and research. So you're going to summarize the literature that you found and already talked about and talk about how that research applies to nursing and how it applies to nursing research. And then week 8, the discussion is not about your topic. That week 8 discussion is all about what you learned that you believed is valuable about this class, and you could, of course, bring your topic in because maybe you learned some really important things about your topic through research that you can apply back to nursing. So in that way, it could be about your topic. Okay, so I know that's a lot. That's all the discussions and the articles, the assignments and how they fit together in this class. Now that might have sparked some questions in your mind that you would want to ask me about. Students usually have some questions about what it means to choose a nursing topic. Now I gave you an example already about some medical topics that we want to avoid. Things like treatment choices, medication choices. Those are medical issues. We want to choose nursing issues, and nursing issues in my mind are things that you can do without a doctor's order, things that we can do to make the processes better. The examples on this page are easy choices for this class, and they might lend easily to assignments in future classes if you choose to use them. So the topic of nursing turnover is a great topic for this class, finding research on nursing turnover. And that topic, that information that you find, the research that you find could be used later in other classes. You could even specifically think about a preceptor, the institution of preceptor programs as a specific topic, which can decrease nursing turnover, right? Communication between staff members, even going down to the specific topic of bedside report, could be a topic. Increased infection rates and how we as nurses can affect them. So I don't mean the choice of antibiotics or something like that. That's a medical issue, but I do mean, for example, the use of nurse-led protocols for catheter removals. That's a way that nurses can have an impact in infection rates. Or perhaps change in infection control procedures, oral care for to reduce ventilator-assisted pneumonia. Those are nursing things. Maybe even the use of RFID hand washing processes that are kind of new. Patient satisfaction, that topic, improving patient satisfaction, maybe addressing visiting hours, opening up, widening of visiting hours, or eliminating visiting hours and having open visitation. Family presence for codes, follow-up phone calls by nurses. Those are all potential topics. Falls in the institution of hourly rounding, nursing satisfaction, how we can improve that. Pain, for example, the use of music therapy or aromatherapy. We certainly don't want to drive it down to the use of medications and the choices of medications, because that's again a physician order or physician issue. We want to look at nursing issues. Patient satisfaction, like instituting a dining group. And there's probably many examples of ways that nurses impact patient satisfaction. Alarm fatigue is another potential topic. So these, you absolutely do not have to use examples on this paper, but I wanted you to get an example or an idea of what possible topics are that are nurse-led topics here. These are nursing research topics. And you would be looking for research articles that are written by nurses addressing these things that nurses do. All right, now let me specifically talk about assignment 1. I don't want to get too far into it talking about the details of future assignments, but I do want to start with this. And if you're feeling overwhelmed by the information I've given you already, just reach out to me. I'd love to talk to you about it. So assignment 1 says that you're going to select any nursing research article. So this is about one research article from a scientific journal that's found in a nursing database. You're going to go to our library. Please go to our library in the college, the online library that's in the course, and choose from databases there. Always include in your search full text only. It's one of the choices you'll get when you're doing your advanced search. If you don't choose full text only, you'll get abstracts, but you'll end up getting many abstracts that you don't have the full work for, and that will simply frustrate you. So we know we need a full text article, we need a peer-reviewed journal, we need work that's less than 5 years old, and remember, that's down to the month. So since you're looking at journal articles, it will give you the month. Always make sure you haven't gone over 5 years, right down to the month. It's really recommended, and I put in bold purple, to send your article in PDF format to me so that I can take a look at it before you get started. That way it eliminates some frustration if you're not quite on the right track. And you really need to be able to have a full text article in PDF format anyway. So forcing you to have that, send it to me, will allow you to know you're one step ahead of the game. I will, in the discussion area, prior to the assignment, I will create an additional discussion topic in week 4 that says, please submit your article here if you would like feedback on it, and then I will take a look at it there. You may also submit it to me privately by email if you'd rather not share your article in front of the group. Up to you. Remember though that your article, if you choose a quantitative article, remember you might be able to use it in the next assignment as well. And why make it harder on yourself by having to choose more articles? So the list here tells you some of the things that have to be addressed in the article. So it's easiest to look for an article that already identifies these things for you. Remember, you can't work off just an abstract alone. You must have a full article. You're going to identify things like the problem statement or the purpose of the article. The article's literature review. Every research article must have a literature review section, and some people will call it a literature review, some people will not. They'll just integrate their sources in, and you have to kind of figure that out by yourself. The participants or the sample that's being studied, and the inclusion and exclusion criteria, sampling issues such as probability, non-probability, how they got their sample, and the number of subjects used. Is that number enough? Did they tell you if it's enough? The study setting, where the data was collected. Informed consent. We love to see information about informed consent and how consent was obtained and whether there's any other ethical issues. A hypothesis or research question. The research design, experimental, non-experimental, descriptive, exploratory, predictive. Those are just examples. Identify the research variables. Describe how the data was analyzed. What statistical measures were used if it's a quantitative research study. And describe the results of the study and the appropriateness of the methods used, including limitations. So this list, if you were to just print it off and make little check marks as you go down it, to see if your article is good enough for you to do a literature review on, a critique on. And if it's not, if you're missing, many articles have a lot of good stuff in them, but might be missing a few of these. Like maybe your article doesn't talk to you about the sample size, how it was obtained, or whether the sample was large enough. So it's okay if you don't have everything on this list, but if you don't, because you're critiquing it, you're saying whether it's good enough or not, whether the authors did the right thing or not. So if things are missing from this list, it will be your job during the critique to say that that information is not provided by the authors. And then you would probably need to say what you believe it to be. So for example, if the methods used in the study are not named, you would say, while the authors did not state the methodology used in the study, however, given the information provided in the article, the method appears to be blank. And then you would have to fill that in. So you can see how your work gets easier if you pick an article that has all this information for you, or as much of it as possible. This again is assignment 1, where you're picking one research article and critiquing it. So you're telling us not only the information in it, but whether the authors did a good job or didn't do a good job. So that information, I know it could be too much information. You might be feeling overwhelmed. I want you to reach out to me if you are, but hopefully that specific detail will help you to pick your topic and your first article. Please note that you're going to go to our library to find your work. We want you to go to our library, put in as your choice full text only and peer reviewed. Those are choices you get to make when you're searching the library. In fact, if you will keep an eye out, I will do another video on how to search the library for those of you that might not have experience with that. Note that our library can be reached by going to the Resources tab and then the Library tab. And please note that on occasion we have some technological difficulties. In fact, I would have put some screened information up here right now, but I can't get into the library this very moment. So I will do a second video for you for that. And then remember, you also have 2 remaining assignments, and I wanted you just to see a little blurb about them so that you would understand where you're going next. I don't want you to get overwhelmed by what's to come, but I want you to know what you're picking your topic for and how it's going to be used later. So assignment 2, that first part of the final assignment, is a literature review where you are continuing on with the same topic unless you're told to change it, or if you can't find research on it. And you're going to present the literature findings on that topic, what's known about the topic. This is in relation to nursing, and then you'll apply it to nursing practice. And this is going to be from quantitative research only. So because it's quantitative research only, if you will start your week 4 assignment by looking for quantitative research, you could use it as one of your articles in assignment 2. And then the final assignment, which is due in week 7, is the 2-part assignment, because it's the first one that you submitted here in week 5. You're going to fix anything that you were given feedback about and add to it a summary of the overall findings and how these are applied to nursing research and nursing practice, how the recommendations and the summary is applied to nursing research and nursing practice. So those are to come, and I will certainly tell you much more about those. But I just wanted to give you an understanding of what was coming. You're going to check back later to see a virtual field trip to the library. If you have questions, I would love to hear from you. Remember, you're looking for high-level evidence about a nursing topic, and that generally means written by nurses, though that's not always true, but almost always. Recommendations in the research articles are actions that nurses can take. That'll give you a big help. And then do not rely, the topic that you choose shouldn't rely on physician orders, but rather nursing actions. And always choose peer-reviewed journals from the last 5 years, full text articles only. All right, folks, that is probably enough from me. You're probably way past your limit of information from me today. So if you have questions, call me, reach out to me. I'd love to talk to you. If you want to float a topic by me to see if it works, let me know. Otherwise, I'll be looking closely at your topics in the discussion areas for week 2 and week 3 and possibly even week 4. And then I'll ask you for the PDF article in advance so that you can really get it approved before you do the hard work. All right, folks, have an awesome rest of your day, and let me know what questions you have.